Good morning. This lecture is on hydrocolloid impression material. Recent advances. Let's start with agar. It's a reversible hydrocolloid impression materials. It is hydrophilic in nature. It is available in bucket form and paste form and cartridge form. Processing of this agar material needs a conditioning unit. It has liquefaction compartment, storage compartment and conditioning compartment. We need to make the agar into small pieces and put it into the liquefaction compartment. At the temperature of 100 degrees centigrade, the agar become melt. Then it can be stored at 65 degrees centigrade in the storage compartment. Before the arrival of the patient, the material can be transferred to the conditioning or tempering compartment. For making agar impression, we need to use a special type of tray, that is water cooled tray. You can very well appreciate the inlet and outlet. When you pass the cold water through the inlet, that will bring the temperature in the agar to low level so that the salt becomes gel. Then the water will come out as a warm one. And the next one is the uses of agar. The agar material is used for making impression for fixed partial denture and duplication of dental cast. And a very important technique that is called wet field technique. Wet field technique is nothing but before going to make impression with agar, we need to flush the oral cavity with warm water so that that will remove the food particles as well as the saliva and the oral cavity, and so that we will get a better hydrophilic impression that will be compatible with the gypsum products. Move on to the alginate hydrocolloid. It is a irreversible impression material. For making alginate impression, we need to use a perforated tray or rim lock tray for making maxillary as well as mandibular impression. Let's see the recent advances. Usually, the alginate is available in powder form. Nowadays, it is available in salt form, which contains water and reactor of plaster Paris added to the salt. Next one is paste form. In this, alginate salt and the other contains calcium reactor. The dust-free alginate contains glycerin as the one of the ingredient, and the chromatic alginate changes with different stages. The flavored alginate contains mint, pineapple, orange, and also nowadays alginate is available with this ingredient agent. Let's see each alginate. The two paste form it's coming. This paste contain alginate salt, filler, retardants, and the other ingredients. The other paste form contains calcium as the reactor. We have one more alginate, that is extended pour alginate. Usually the setting time is 3 to 4.5 minutes. The extended pour alginate, we can prolong the pouring time. Class A type 1 alginate, it is a thixotropic material. Minimum setting time is 30 seconds. We will get a high accuracy with this alginate. It has long dimensional stability, dust free, and the expiry date is 5 years. Major failure encountered with alginate impression is separation of tray and the impression. To avoid that, nowadays tray adhesives are available. These tray adhesives contains polyamide or diethylene triamine polymer, ester gum, and rosin in isopropyl alcohol or a combination of isopropyl alcohol with ethyl acetate. When you apply this tray adhesive, we have to wait for 1 minute, that will evaporate so that they facilitate the addition between alginate material and the tray. Next one is dust-free alginate. The dust-free alginate, the powder contains glycerin or glycol as an ingredient. The chromatic alginate means the alginate material sets in different stages. So it is a reminder for us that the material reaches so and so stage. Actually, it is a combination of inorganic and organic material, that is cresol red, naphthalene along with the pH indicator. Initially, the color of the alginate will be in one color. After mixing with the pigment and the pH indicator, the color change starts. After setting, it will become in a different color. This may be purely due to the pigment. The next one is flavor alginate. This flavors like mint or pineapple or orange flavor is added. This flavor alginate is mainly helpful for pediatric dentistry for making impression in the child. Alginate with disinfection. Nowadays, many patients are reported with syphilis, HIV, and hepatitis B. To avoid cross contamination, now alginate is coming with the disinfectants, mainly quaternary ammonium salt or chlorhexidine. For further reference, you can refer this following textbook regarding the recent advances in hydrocolloid impression materials. Thank you.